Hi, my name is Courtney, and I am currently a student at Fresno Pacific University studying my family nurse practitioner. Today I'll be discussing the pathophysiology of sepsis before ICU on Monday, where we'll talk about signs, symptoms, and treatment of the septic patient. So sepsis, it's estimated that 1 million cases occur in the United States annually, causing more deaths than prostate cancer, breast cancer, HIV, and AIDS combined. This costs hospitals an estimated $16.7 billion. Sepsis kills more than 258,000 Americans a year and is the 11th leading cause of death. This is why, as nurses, it's important to understand and recognize the early signs and symptoms of sepsis. It can happen to anybody, infants, toddlers, adolescents, young adults, it's elderly, it happens to everybody. So what is systemic inflammatory response syndrome? This is also known as SIRS, which you'll hear about it mostly described as SIRS. This is an acute host reaction to various different stimuli, including both infectious and non-infectious causes. So this could be in a response to trauma, surgery, myocardial infarctions, burns. There's all different reasons your body is going to start to respond. It doesn't necessarily mean it's an infection just because you're having an inflammatory response. So in order to become sepsis or be defined as sepsis, you would have to meet two criteria in addition to the signs of the inflammatory response. So the two criteria could be temperature or high blood cell count, or high blood cell count and low oxygenations. So there's multiple area, they just have to meet the two criteria. So what is sepsis? Sepsis is an overwhelming and life-threatening response to an infection that can lead to tissue damage, organ failure, and even death. It is the body's overactive response to toxins from the infection. A patient must meet the SIRS criteria, as I was discussing, and they now have a known infection source that's making them diagnosed as sepsis. This could be bacterial, parasitic, viral, or fungal. So this is the patient that now has a diagnosis of pneumonia off of a chest x-ray and has the signs and symptoms of SIRS. These are the patients now that we're describing as septic. So what is severe sepsis? This is the patient that's been now diagnosed as septic and now has developed an acute organ dysfunction with hypoperfusion and tissue hypoxemia. So sepsis-induced hypoperfusion or hypotension is defined as a blood pressure less than 90 or a MAP, the mean arterial pressure, less than 65. This patient now is starting to need assistance maintaining a normal blood pressure with fluids like lactated ringers, possibly may need to be started on IV support for their blood pressure, also some oxygenation. They may be needing BiPAP or high-flow nasal cannula. And when they're in the severe sepsis, the most common organs affected are heart, lung, and kidney and blood vessels. So what is severe, or what is septic shock? This is also known as distributive shock. You may have heard that term before. This develops from volume loss in the core circulation and poor circulatory support. This causes a life-threatening drop in blood pressure and reduces urine output. There's temperature changes and late inadequate tissue oxygenation. So this is the super sick patient. If they come to the emergency department presenting this way already in septic shock, the mortality rate is very high. We're very behind the game. This is going to be the patient that's going to be needing immediate central lines, arterial lines, rapid IV fluids, and IV blood pressure medications to support their system. So what's your body's response when you're in SIRS? So this is that damage is being done to tissue. It triggers an inflammatory response. Systemic responses start to occur, which is fever, hypothermia, hyperthermia, tachycardia, tachypnea, and either leukocytosis or leukopenia. So again, the hypothermia, some people forget that there's the cold sepsis. Sometimes an elderly woman falls, isn't found for a day in winter, is brought to the ED and is very cold. That doesn't mean that she is necessarily SIRS or becoming septic. But if you find that infection and there's hypothermia involved, they still meet the criteria to be SIRS and become septic. Same with the leukocytosis and the leukopenia. Those numbers don't necessarily mean they aren't headed that way. They can still have a low white blood cell count and be becoming septic. This is, and this is what is known as the SIRS, or systemic inflammatory response. So what's your body's response to sepsis? This is the capillaries. They start becoming more permeable. This is what starts the hypotension process, and fluids and immune mediators are being released. These are your platelets, your red blood cells, your macrophages, all your clotting factors are being released at this point. So this compromises blood flow to the organs and tissues. The intravascular volume decreases, dropping too low to maintain tissue perfusion. So now your adrenaline is being released to make up for that, and that causes tachycardia. So the adrenaline is being released in response to that permeability and that vascular dilation and inadequate volume in the body. So your cells are now switching to aerobic, from aerobic to anaerobic metabolism. And this is what causes the metabolic acidosis. So when your cells switch from aerobic to anaerobic, they're now basically using the reserve in the body. So your body naturally wants the oxygen, the aerobic, when it's exercised and all of that for your muscles. So now your body has that lack of oxygen and is now using anaerobic resources to keep the body functioning. So that's when you're getting your lactic acid being released from that anaerobic use. This results in the lactic acid being built up, which is what's causing the acidosis. And the lack of this circulating volume is what is going to cause the organ failure. So what is your response to septic shock? The body's response is, this is now when all major organs are starting to suffer. This is the final cascade of sepsis. GI peristalsis slows due to the lack of the perfusion to the gut, and that's where you're more susceptible to get this bacterial movement that comes out of the gut into the bloodstream. The liver is unable to metabolize waste products, so it cannot metabolize drugs being given to help fight the infection, or the lactate that's being elevated in the body from the infection. It's not able to release those. So the patient can become jaundice or have a severe liver infarct from the clotting cascades, and that can also cause them to die. Acute renal failure due to hypoperfusion to the kidneys. The hypoperfusion causes decreased urine output, and so because of that, it elevates your blood urea nitrogen and your serum creatinine, which you'll see on those lab results. So the lack of circulating volume, this is what results in your organ failure and death. So thank you for listening to my pathophysiology on the stages of sepsis, and I look forward to seeing you on Monday. Thank you.